Everyone, and welcome. My name is Miranda, and I am delighted to be your moderator for today's Make the Change for Kidney Health webinar, where we explore how we as an NCD community can strengthen advocacy for a kidney health resolution and ensure that kidney disease remains visible in the lead up to the fourth UN high-level meeting on NCDs. The NCD community finds itself at a critical juncture where kidney disease and other NCDs are the leading cause of death globally, yet progress in reducing premature deaths from NCDs remains insufficient. 2025 presents us major opportunities to bolster advocacy, to have kidney disease and other NCDs feature more prominently on the global and national policy agenda. One key moment is the proposed resolution on kidney health, which, among other things, urges countries to adopt policies that we know are proven to improve prevention, early detection, and treatment of kidney disease. The proposed resolution will be up for discussion and potential adoption at the 78th World Health Assembly in Geneva in just 2 weeks. So we're really looking forward to that. Another key milestone is the fourth UN high-level meeting on NCDs in New York this September, where global political leaders gather to adopt a new political declaration that would be aimed at accelerating progress to reduce NCD-related deaths globally. I am very happy to have joining me two of our valued partners, Magdalena Machalska from International Society of Nephrology and Miranda Wang from NCD Alliance, who are going to help me unpack how these two moments can strengthen our collective advocacy for better screening, early diagnosis, and treatment of kidney disease and other related NCDs. This webinar is brought to you by the Global Patient Alliance for Kidney Health, a global collective of over 30 patient advocacy organizations committed to ensuring the timely access to kidney disease screening, diagnosis, and treatment for all. On today's program, we will kick off with presentations from Magda and Miranda, which will be followed by a panel discussion and Q&A session. We'll close off with key takeaways and a call to action, and also share some resources we hope will be useful for you as you take forward some of the recommendations we share with you today. Before we begin, a reminder to please use the Q&A function to submit your questions and comments to us. We will read them in the course of the discussion and, of course, read them out loud when the time for the audience Q&A begins. Without further ado, Magda, welcome. I'm going to hand over to you to begin your presentation.
Thank you so much, Miranda. Good afternoon, good morning, everyone. First of all, big thanks to Global colleagues for inviting me to join this webinar. It's a great honor. During my presentation today, I will briefly talk about the WHO Kidney Health Resolution, what it is, why it is important, and most importantly, how you can support and engage. But first of all, before we go to the core, let me quickly introduce you my organization, the International Society of Nephrology, which was established in 1960. It is a global professional association dedicated to advancing kidney health worldwide. Together, it gathers over 30,000 of professionals in the nephrology field, over 10,000 through national and regional societies. Also, ISN provides a range of grants to support kidney care initiatives, including research, education, capacity building, especially in low and middle income countries. Next slide, please. Our vision is a future where everyone has access to equitable and sustainable kidney health. Next slide, please. So, about the WHO Kidney Health Resolution. Next slide. What is it? First of all, it's a document, a formal document adopted during the WHA, the World Health Assembly, by all WHO member states, members from 194 countries. The document, the resolution aims to agree on public health priorities, and it's not a binding document, although it provides a framework to member states for action. It's a politically strong document, and it's implemented by the member states, by the ministries of health, but the technical support is provided by the WHO. I brought here a very interesting example of another resolution that led to a quite impressive outcome, the tobacco control resolution that laid the foundation for the WHO Framework Convention on Tobacco Control. Next slide, please. So where did it start? The entire discussion about the WHO kidney health resolution started exactly 1 year ago during the last World Health Assembly in Geneva last year. On 29 May 2024, during the WHA, ISN hosted a side event during which the Minister of Health from Guatemala stood up and committed officially to support the resolution, to submit the request for the resolution to the WHO, which actually happened in October. Then, towards the end of the year, the resolution went through a series of negotiations, and it was presented during the last executive board meeting in February by Thailand, the sponsoring country and member of the executive board. It was proposed, it was agreed to put the resolution on the agenda for the upcoming WHA in May this month. In the meantime, what happened is that there were a series of very important developments, including also countries such as the United States deciding to pull out from the WHO. Therefore, there were considerations about the budget implication, about considerations regarding the financial implication of the resolution if adopted. Therefore, although it was proposed for potential votes during the WHA, we are not sure 100% whether it will happen. Here I have provided you with the link to the version of the resolution that was presented during the executive board meeting. It's on down left side, and on down right side you can have an idea about the implication on the next 2 years budget of the WHO, and also estimated cost of the resolution, which is $16.3 million over the 2 years of next 2 years of the budget. Next slide, please. So, given the current context with heading up to the WHA, with uncertainty about what will happen, we have to consider 3 scenarios. The first one, the resolution is adopted as it is proposed. It is the best scenario ever. Second scenario is that the resolution is adopted with minimal costs, just to keep the momentum. And also, the third scenario is that the resolution will be adopted next year during the next WHA, which is somehow dangerous because we don't know what will happen next year. So the best scenario is the first one, resolution is adopted as it is. And it is important for the entire kidney community, but not only, beyond kidney. The resolution promotes awareness, education about the kidney disease, as it recognizes formally the World Kidney Day campaign, a campaign that is led by ISN and the International Federation of Kidney Foundations, the patients community. to raise awareness about the kidney disease. Let's not forget that kidney disease is a silent epidemic. It is very often unnoticed until very late where the costs become very important of the management of the kidney disease, but also the impact on the quality of life is very important. The resolution provides financial security. It's calls for access to essential diagnostics and medications that slow the progression of the kidney disease. Quality of care, it also provides supports settings for person-centered care, especially in low and middle income countries that are referred as developing countries in the text. Next slide, please. Given the current context, since February, ISN has developed a very targeted strategy to advocate at regional, national level with the governments that ultimately will vote for the resolution. And here we also engage with the entire network, including GLOPAC, to call on governments really to consider supporting the resolution. We have developed a series of materials. Here is the link to the website where you can find different materials such as an open letter to governments signed by 17 organizations, including GLOPAC, and those signing are the patient providers, but also beyond the kidney health community organizations that represent the stroke, the circulatory health, diabetes. So it's a broad community, 17 organizations calling on member states, the governments to support the resolution. This is the open letter. There is also on the webpage you will find, if you go there, one-page summary with the key points, why the resolution is important. A template email in a Word format, you can cut, paste, translate, use however you wish to leverage the message to the governments you are in touch with, and suggested visuals. It's very important that we all engage in supporting this initiative. The voices of those directly affected are the most powerful force, in my opinion. And we count very much on your support. We still have time. We have 2 weeks' time. Please go to the website. Please consult. You can always reach out to me if you need further information and to ask how you can support. Next slide, please. And here a very quick overview of what ISN is looking at doing during the WHA. Here is a side event we are hosting on Wednesday, 21st of May in the morning. 2 expert panels. The first including the civil society stakeholders that will share their views why it's important for them to have the resolution adopted. We'll have representatives from the patient community, from the providers, also from the industry organization. And a second panel will focus mainly on the governments. We'll hear from those governments supporting the resolution, why it was important to engage in this initiative, what motivated them. Here is, and you can definitely register. The event will be provided on site, but also you can join remotely and follow the discussion. Clicking on the link provided on the slide will bring you to the website where you can register. And I can only encourage you to join discussions. Thank you so much.
Thank you, Magda. That was really great. I really enjoyed the comments you made about the fact that, you know, the voices of those directly affected are the most important voices that we have. And that really speaks to the core of the work that we all do as the patient community, is to take these opportunities for engagement in policymaking and make sure that the patient voice is prominently heard and appreciated in how we advocate for policymakers to do the right thing. We will share the resources, the links that you have on the slides with our partners to make sure everyone has access to the registration link for the webinar and that, part of your website with all of those useful resources. So thank you so much. We'll come back to you for questions later. So now I'd love to welcome you, Miranda, to go ahead with your presentation.
Hello, good morning and good afternoon, and thank you for having me today to speak about the high-level meeting on NCDs and mental health and how everybody can contribute to this effort. Next slide, please. I'm not going to go through all this, but this is just to say that the NCD Alliance is a global network with more than 400 members and NCD alliances around the world. And we are a small team based across Geneva, London, and New York. Next slide, please. We bring together a lot of different organizations that work across multiple diseases, risk factors, and of course, for expanding coverage and strengthening health systems. Next slide, please. And this is what I wanted to focus on today is how we're bringing everybody together for global advocacy towards the UN high-level meeting on NCDs and mental health that will take place in September in New York. This is an incredibly important time, incredibly important year, an incredibly important month, actually, which I will get to in my presentation. So the high-level meeting is a process that happens in New York, and what it does for our issue is that it elevates our health issue to the global and political and development space. And so this is a year where different ministries of health in all the countries are meant to be talking about NCDs and mental health and everything under there. So it's not just ministries of health that is involved. It's going to be a larger discussion about how this affects development overall. For this process, the process is as important as the outcome because the ministries are supposed to be focusing on NCDs and mental health this year. They are going to be negotiating on texts for a political declaration. These are the political side of things. So they are not content experts. So it's important to really engage the different ministries and with your countries in this process to advocate and educate about NCDs and mental health. And it's also a stepping stone towards the SDGs and beyond, because we're in 2025 and we still have 5 more years for until the 2030 SDGs, and conversations are already starting on what happens beyond the SDGs. So this is a really important time to ensure that NCDs and mental health stay in that global field. Next slide, please. I just wanted to point out that it is a very political process, and this is very important to know so that you understand who you need to be talking to when it comes to the high-level meeting, when it comes to the World Health Organization. So in New York, it's a very development-focused conversation when it comes to the high-level meeting, and every country has their permanent mission in New York. They also have a permanent mission in Geneva, which works with WHO on items that Magdalena just spoke about on the resolutions. But it's incredibly important for them to get the expertise and the content from their governments in capital, whether it be through the Ministry of Health or the Ministry of Foreign Affairs. And so where we find ourselves as advocates is that we do need to be speaking both in country and supporting the technical experts in the ministries of health, but then also reaching out to our country missions in New York and Geneva, if that's allowed in your country, and providing them with the content so that they can appropriately negotiate on these texts. Next slide, please. So I'm not going to go through all of this, but this is just to say that this is the high-level meeting process started, more than a year and a half ago, and this is what's left for 2025. So the Geneva process and the side is concluding. They will still be providing guidance in New York. But next slide, please. But now in May, we are heading into the actual negotiations of the political declaration, and this is the time where countries will convene in New York to deliberate on the political declaration draft, which should be coming out next week. So this is the exact time that you want to be engaging with your governments in country and with your missions to support strong language in the declaration. Next slide, please. I just wanted to point this out because, today is the 7th, and in 1 week, it's been confirmed that the zero draft will be released on the New York side. During this time, all the missions, of course, in Geneva will be engaged with the World Health Assembly. But then also in New York, the deadline for written comments to the political declaration will be on May 29th. And so it's important that in this crucial 2.5-week period that you reach out to support your countries, provide comments on the political declaration zero draft. Next slide, please. Because this zero draft is the only time that a draft is actually going to be released publicly. Once the comments are compiled and they release another draft for circulation, the following drafts will not actually be released to the public. So it's very important that you have your connections to the government and the ministries so that you understand what kind of conversations are happening after it is not public anymore. Next slide, please. So there's two things that I wanted to emphasize that NCDA is doing and a lot of organizations working towards a high-level meeting are doing. There's both the direct advocacy that's happening where you're talking to your decision makers, but it's also necessary to create that noise and show that public support for the high-level meeting and this political declaration. And so they feel that pressure to actually ensure the strongest language. And it's combined where you make the greatest impact when it comes to advocacy efforts. Next slide, please. So the UN multi-stakeholder hearing just happened in New York, and there were about 400 registrants, up to 500 attendees, where this was the last chance that there was an open stakeholder hearing where people got to express their views on what we would like to see in the political declaration. And the co-facilitators will take that information in the statements and try to see how to best integrate and reflect some views. Next slide, please. So for the multi-stakeholder hearing, the NCD Alliance brought together 30 advocates from around the world representing different communities and different voices and people with lived experience to deliver the message to governments on the call to lead on NCDs. It's an open letter where we're calling for governments to mobilize investment, accelerate implementation, and deliver accountability within the political declaration. And it is our campaigning tool globally to unite everybody around the high-level meeting. So I did put a QR code here in case you want to sign as an individual or on behalf of an organization that you represent. Next slide, please. Because so far we're still collecting signatures, of course, but we have over 115 countries represented as of end of April and over 545 organizations who have signed on. So we really want to continue collecting these signatures so that we keep on growing our collective reach and we can take this document to our governments to show that it's not just us alone calling for stronger language. It is a global community and a global call to action. Next slide, please. So we also have resources as well, just like ISN. Ours is a bit more broad towards the entire NCD community, towards the high-level meeting, but it's ready to use tools, resources, guides to reach out to your missions, to reach out to your government, but then also to become active on social media, help you produce videos in order to express your advocacy messages under the Time to Lead campaign. Next slide, please. If the high-level meeting and the road towards a high-level meeting is new as it is to many of us, we also have 2 advocacy pocket guides to explain, how you mobilize towards a high-level meeting, but then also how you can build strategic relationships within your country towards the missions in order to advocate for your priorities. So these can also be found on the actonncds.org website, but I just wanted to highlight them because they're very focused on the high-level meeting. Next slide, please. So this is my last slide. So what the NCD Alliance did last year was we gathered all of feedback from our network, and we identified priorities towards a high-level meeting, which are these 5 buckets. Of accelerating implementation, breaking down silos, again, mobilizing investment, delivering accountability, and making sure that people are engaging their communities in this process as well. And what we hope is that different areas or issue areas or disease areas can see their calls to action reflected within this document, and it unifies us across the NCDs and mental health space. So that, I think, is my last slide. Apologies for going over.
No, it's okay. Thank you so much, Miranda. I love how simplified this call to action is, and like you said, that it can very easily be applied to different, health issues and the NCD space. So thank you so much for reiterating them at the end, but for you to repeat them as we close out so that people retain that information as some of our key takeaways for the session. So thank you for that. So now for our panel discussion, I'll kick off with a question to you, Magda. So Guatemala is the one country that took the bold step of proposing the kidney health resolution, so really showing great political commitment to such an effort, which has enabled for that resolution to now be, recommended for approval by the WHO Executive Board. So I want to know from your perspective, what are the key strengths of the resolution? You mentioned that the resolution is not a legally binding document, so it's not really compulsory, but, there are some elements of that document that might encourage other countries to support it at the World Health Assembly. Can you please give me an idea of what those strengths of the resolution are?
Absolutely. Apologies, I was muted. Thank you, Luyanda, for the question. Definitely, it's not a binding document, but it's a framework for action and very political, strong signal. 4 points are key, in my opinion, when we talk about the resolution. First of all, this resolution, as I mentioned, promotes awareness, education. Kidney disease is a silent epidemic once again. So given the resolution recognizes officially the World Kidney Day campaign, it's a strong signal that government should look at awareness, educating people. Second point, strength of this resolution is that it does enhance prevention and early detection. The resolution advocates to integrate the case finding, early detection case finding into the integrated approach addressing the shared risk with other conditions, circulatory health conditions such as CVD, such as diabetes. Third point, which is key in my opinion, is that and I did mention, is the financial security as well. The resolution does promote access, enhanced access to essential diagnostics, medication. Let's not forget that, for instance, 90% of people in need, for instance, of dialysis, they cannot afford it. So many deaths could be prevented. Fourth point that is very strong in this resolution, in my opinion, that incentivize governments to support is definitely the strengthening of the health system management. It provides framework to build setting to provide person-centered care, especially in low and middle income countries. So again, it's not a binding document, but it provides a framework to action. And it's a strong signal that kidney disease should be prioritized in public health agendas.
Thank you so much for that, Magda. I love that you made mention of patient-centered care. It was a major topic for the webinar that we had in February with Bill Wang, from the ISN. So it's great that we are seeing some of that language permeate through documents like the resolution to inform how governments adopt frameworks like these to improve their response to kidney health or kidney disease and other NCDs. Miranda, you did a great job describing the various processes involved with the high-level meeting on NCDs and mental health in September. Global platforms like this, where decisions are made that affect the public, aren't always easily accessible to civil society. So I'm very impressed to see how your organization has taken the lead to create platforms where people like those from our communities can be engaged. What opportunities can you sort of distill for us? You've mentioned some of them in your presentation. What are they? What are the opportunities we have between today and the high-level meeting on NCDs to make our case for the prioritization of kidney health and other NCDs towards a high-level meeting? That, as we walk away from this webinar, our community can easily remember and know exactly what to do with them.
Thank you. That's a tall order. So when it comes to the opportunities left, so this whole time is one big opportunity. As I mentioned, the process is as important as the outcome when it comes to the high-level meeting. And so just think of it as in the next, 2.5 months, the advocates need to be going out there, reaching out to your governments, reaching out to your missions, and telling your story about why it is so important to have the strongest language possible in the political declaration. When it comes to the actual messages in the political declaration, it's best to use, higher level priorities, because this is going to be a development focused, an economic focused document. So I think all of the issues that relate to kidney health are super important, and it can be framed in that, systemic, holistic approach that we all need to see in order to improve, the prevention of risk factors, primary health care, early diagnosis, and access to treatment and care are incredibly important across the entire NCD and mental health field. And then last but not least, I think while we are focused on the high-level meeting, it's important to remember that we want to go beyond just this political declaration document. It's going to be a political document, but the most important thing is what you do with it afterwards. So it's the same as what's happening with a resolution. It's a non-binding agreement, but it serves to guide member states and serves to guide countries on what they should be doing in these fields. So it's up to the advocates that, especially once this document is agreed upon, that you take it and you go and you translate it in country for your government officials about what you need to see and how this needs to be implemented on your specific issue areas. So it's, meeting with them now to ensure the strongest possible language, but then afterwards ensuring that it's actually implemented in a way that directly translates into what's needed in your country.
That's super helpful, Miranda. We are in a time in the global health space where there's a lot of confusion and concern for the outlook of global health, given the, challenges we're having with resourcing. And I think, it's really critical now that governments really take on guidance like these frameworks, like these political declarations, to help structure the response to NTDs. And that the resources don't go wasted. So Magda, it goes without saying that kidney disease has a major impact on the health of our people and the integrity of our health systems. What key steps should governments take to put kidney health higher on the agenda? So how can they take the resolution as a framework, as a guide, to make the changes necessary in the countries where we all live, so we can see the results that we so desire?
Thank you, Luyanda, for the question. Very important question. I can share my own views, of course, depending on local priorities, governments will need to act as appropriate. However, I believe that there are three actions indeed. Kidney disease is a big burden on people, on the society, and on the economy. And to use the resolution and address kidney health, there are three key steps, I believe. So first of all, to recognize kidney disease as the priority in a broader NCD agenda and to integrate kidney health into national strategies, either targeting NCDs or kidney disease. Also, I believe it's important to invest in prevention and early detection. Kidney disease can be prevented using cost-effective, evidence-based measure. There is evidence showing that investing $1 in early detection and prevention of kidney disease can bring up to $45 direct and indirect benefits to the health system. And the third thing, I believe, where resolution could help is really to strengthen the person-centered care models through the primary care, to strengthen the primary care. And this is how the resolution could help. Definitely, it's like a model, but it would need to be translated into the national context if the resolution is adopted.
Thank you so much, Magda. Miranda, finally, the Global Patient Alliance for Kidney Health carries the key objective to call for greater access to kidney disease screening, diagnosis, and treatment. How can the kidney health community garner support from the broader NCD community to support efforts to achieve this goal? You made a great comment in your presentation about the fact that it's not just up to one segment of the community to drive efforts towards engagements like towards having stronger language in the political declaration, but that the entire community and its allies have an opportunity to really be actively engaged. So can you give one or two examples, examples you've seen or facilitated or observed that you feel like would be emblematic of what the kidney disease community can do to engage the broader NCD community for stronger action towards this goal?
Yeah, sure. So, within the health space, we also have our own silos. So when we say we want to break down silos, we have to do that ourselves as well. And, find that common ground, find those common priorities where we can align. And so I think the call to lead on NCDs is our own example of how we wanted to bring everybody under the same umbrella. And one of the things we did have to do, and you guys are doing a great job doing it as well, is to take our messages and basically create a sort of cover note and say, this is why this is important for your issue area, for your disease area, and ensure that the messages are such that if you support it, we will both win. There's no like losing situation here. It's we're stronger together. And so we did have to do basically individual reach out to show how mobilizing investment, how accelerating implementation and delivering accountability directly applies to the different areas across the NCDs and mental health space. And you have to make it easy for them to say yes, to sign on and make those connections clear. One last thing I wanted to point out when it comes to the global patient advocacy community is that your stories are really important. One of the things that we saw at the multi-stakeholder hearing was that the messages from the advocates and the patients were the ones that got the most attention. And so just realize that your voices do need to be heard, and you need to find and collaborate with other organizations to ensure that your voices are reflected in the advocacy work that's happening.
We are stronger together indeed. I know some people treat that as a cliche, but it's more important now than ever for us to really behave like a coalition of organizations, people, patients, systems that really want to work together to achieve the goals that we so desire. So thank you so much, Magda and Miranda, for that conversation. Moving on to our audience Q&A, we have a comment from Colin White from the Irish Kidney Association, who said that they, as an organization, arranged for a parliamentary question to be put to the Minister of Health, asking if they would submit if they would support the resolution. They got a non-committal reply. It's a little bit long for me to read, but essentially it wasn't necessarily the response that they wanted. So while it wasn't a commitment to endorse, the resolution gave Colin and his colleagues an opportunity to raise the profile of kidney health at a domestic level with an international context. So I think it speaks, Magda, to one of the points you made, which was the fact that it's a document that also helps us to raise awareness, right? Raise people's consciousness in our countries for why kidney disease is something important for our countries to take seriously at a national level. I don't see any other questions in the chat, but I'll continue with the presentation. If something else comes up, I'll read it for you and Miranda to respond to. So, we as GLOPAC are committed to supporting the efforts described by Miranda and Magda. Hang on, one question's just come in. But Wang from ISN, he asks, how to achieve the potential tangible benefits of including CKD into NCDs at local levels. I don't know who wants to take this question. It is a big question because it's asking for tangible benefits. And I guess, yeah, I don't know if Miranda or Magda want to take this one live or take it on offline.
I can try to answer. It's a very difficult question, and thank you very much, Bill, for asking. Outcomes. So what outcomes are we looking at? Patient outcomes, economic outcomes, healthcare system outcomes. So the evidence needs to build up. However, integrating kidney disease into national strategy can only benefit. As I said already, there is evidence saying that investing in early detection, prevention of kidney disease brings up benefits, direct, indirect benefits. And there is a reason for other conditions to be included in national strategies. But very often kidney disease is lacking from this framework. It doesn't answer your question, Bill. However, I believe these are some directions for reflection.
Absolutely. Thanks, Magda. I think this is why such engagements are helpful, is that we bring prompts, questions, comments to these forums that we can continue engaging with as we continue to find solutions to these pressing issues. So, the Global Patient Alliance for Kidney Health has been doing our best to engage in some of these processes that Miranda and Magda described. For example, on World Kidney Day, we published a blog article which highlights the World Health Assembly and the high-level meeting on NCDs and mental health as a key policy moments for advocates to leverage for the ongoing push for prioritization of kidney disease and other NCDs on the global agenda. It's on the website, and you can, scan the QR code to have a look at it there. It also summarizes some of the key elements of the resolution, just in case you haven't had access to the document yet. We also had our colleague Brian Kennedy participate in the UN multi-stakeholder hearing that Miranda mentioned. It was on the 2nd of May in New York, and we published a statement which really leverages some of the language in the NCD Alliance statement and calls for shifting from a reactive approach to how we address the NCDs and to a more proactive approach so that we focus on prevention strategies and exercise greater vigilance in how we improve screening and case finding for kidney disease. Finally, we are collaborating with some of our partners to co-host a side event called the Cardiovascular Kidney Metabolic Early Diagnosis and Treatment Forum, where we are going to talk about how we can prioritize screening and early detection of NCDs. It's going to be a forum that convenes policymakers, clinical experts, patient advocates to underscore the urgent need to prioritize prevention and screening. We want to highlight the lived experiences of people with these conditions and illustrate the burden on them, caregivers, health systems, and economies at large, and then to also use the forum to continue building momentum and driving policy action among decision makers to advance our much needed global commitment to prioritizing these conditions on the global and national policy agenda. So in closing, I think that we're all on the same page that 2025 is really a pivotal year for us to elevate kidney disease and other NCDs with key milestones like the World Health Assembly in May and the UN high-level meeting on NCDs and mental health in September. These moments really offer us critical opportunities as the NCD community to push for adoption of the kidney health resolution and also inclusion of really, really strong language in a new political declaration on NCDs that can really help our countries do a better job responding to NCDs. So the opportunity is now for us to urge policymakers to support these advocacy tools and expand access to screening and early treatment starting now. Thank you so much, Magda and Miranda, for your time. Your insights were fantastic. Appreciate all of you for joining us for this webinar, wherever you are in the world. And we hope that you found this session informative and a useful resource for you engaging in these processes. We are going to share a recording of this webinar to all of you, and I encourage you to please share it with your network, your community, your stakeholders, especially policymakers have the opportunity to make this change that we so desire. Stay tuned for announcements about the next Make the Change for Kidney Health webinar. And to keep updated on all of our engagements as GLOPAC, as well as our allied stakeholders like ISN and NCD Alliance, please visit GLOPAC's website and engage with us on Facebook, X, and LinkedIn. Until next time, thank you so much.